In order to be safe and of high quality, healthcare services need to be standardized. Standards of healthcare services are guidelines for evaluating nurse practice and checking that the provided services are of the given level of quality. Nurses must assert their place in deciding on the quality of healthcare and the leading role in defining the quality of nursing care. The process should build on existing good practice that will make nurses more efficient and protect both them and patients from errors and also increase their job satisfaction. As part of the standards, standard operating procedures have been developed within the Strengthening Nursing in Bosnia and Herzegovina Project. Standard operating procedures represent only one segment of standardization of nurse practice, in addition to standards and norms of healthcare, in addition to documentation, records and the nomenclature. There are many definitions of a standard operating procedure, one being that it is a set of instructions to be followed to ensure safe services without negative effects on the health of the patient, client, staff, or environment. Nurse practice is mainly based on the acquired knowledge and experience. Some of the healthcare centers have certain procedures, however, they differ in format and content. And it is unclear how they were developed and based on what literature. That definitely remains unclear. In some of these facilities, procedures were developed solely for purpose of certification, to qualify for entering the certification process. So these were local documents. The project activities undertaking towards standardization resulted in a manual with standard operating procedures for nursing care that definitely standardizes the procedures, steps to be taken, and determines professional profiles and the way in which the procedures should be performed. Services provided in the community nursing have been standardized since 2008. The procedures that have been standardized are used in everyday work. For us nurses, procedures make our work much easier, and ultimately services provided to the end users are of much better quality. The procedures are available to all employees in electronic and paper forms. At our facility, the standard operating procedures are only partially applied. That means that some of the procedures are applied in everyday work, and others are in the process of development and adoption. The procedures are exclusively developed based on the needs to describe more complex processes of work of nurses. In contact with my colleagues, I often hear complaints that the significance, place, role and status of the nurse in the healthcare system are not sufficiently recognized, not only by the doctors, but also by the health insurance fund and even by the nurses themselves. I am convinced that if standardized nursing services were standardized at all levels of healthcare, the position, role and status of the nurse would be significantly improved. In addition to standard operating procedures, it would be very helpful for nurse services to be adequately recorded. These two segments, the provision of services and their recording, are inextricably linked with the extended list of nurse services of the Health Insurance Fund, which should inevitably result in a better position and status of nurses in the healthcare system. The healthcare center at which I work recognizes the standardization of nurse practice. Nurses at the health center provide services to our patients on a daily basis. Although these services are not standardized, in providing services, nurses mainly rely on their own experience, the experience gained during the education, the experience of more senior colleagues, and of the head nurses, which greatly contribute to the quality of work. However, for this process to be more comprehensive, purposeful, and better, it is necessary to provide all these nursing services in the context of standardized nurse practice.